Oh, hey guys, it's me, Dr. Yusuf. This is, really hate this mask. Guess what? This is what we need to do, guys. We need to figure out how are we going to test patients for the COVID-19. We want to make sure that people who want to be around their parents, their family, their loved ones, they want to get back to work, they want to check and see if they have COVID-19 or not. Did you feel sick in the last 2 to 3 weeks? Did you have a fever? Did you feel cold? Did you have no symptoms at all? Because those are unfortunately some of the signs that you might have COVID. Here's what we're going to do. We have partnered up with a lab that has gotten us some supplies to run what they call a serology antibody test. This is there are 3 ways to test for the COVID. So if you're actively having symptoms of COVID-19, fever, shortness of breath, cough, please think about going to one of the urgent centers or hospital where you can get tested for immediate evaluation. And that usually involves something called either a molecular test or a viral test, antigen test. What we're going to test you for the COVID-19. Whew, this mask. So hopefully finally you can take off your mask, and by testing yourself, and the way we're going to do that is with a blood test in the office. So you come in and we'll do something called a COVID-19 serology IgG test. This specialized test is only done after you've had the symptoms. So if you have had a cough, congestion, a runny nose, fever, you're just not sure if you've had it or not, and it's been 14 days and you're out of quarantine, come on in, we'll check your blood, we'll let you know if you had it or not. One thing it'll tell you is that you're not active with it. Number 2, you'll be able to know that if you've had built up a little bit of immunity, so that your exposure might be less powerful. So right now we're doing, there's only a special number of tests that are available because of the limited, of course, quantities. And only a few laboratories have emergency accessibility to these tests. So unfortunately, not everyone has an ability to run this test without the FDA's emergency approval. Right now, the FDA hasn't fully approved them, but right now we're using them as best as we can under the circumstances. We have to find some kind of testing to do. So if you're thinking of visiting grandma and grandpa, you're thinking of visiting a loved one, you're thinking of going back to work, and you're just not sure if you want, if you've gotten exposure, if you want to be tested, come on in. We're going to check you for the COVID-19 IgG serology test, meaning that it's not an active condition, and if you have an active condition, please go to the hospital or an urgent care center that is going to take you for testing and is prepared for that. We are going to test you for post-exposure, meaning 14 days after your symptoms are gone.